when women from more than 100 countries were asked about their top priority for quality maternal and reproductive healthcare services, they gave a list of demands. And, these are the things that they want political commitment, investment, and accountability on. And respectful and dignified care came on top of that list. I know, these things, respectful maternity care together with sexual reproductive health rights are a right for every woman and adolescent. And there are no exceptions, even in times of crisis. And even during the COVID-19 pandemic, which is putting a lot of pressure on already overstrained health system. As the head of policy at the Foreign, Commonwealth and Development Office, maybe you can just first of all shed a light of what you know or what we know globally on issues of disrespectful maternity care.
Absolutely. Well, thanks, Mercy, for speaking with me. It's such an honour to be part of this event. I mean, there's lots we don't know, but there are 4 things we do know for sure. So firstly, disrespectful maternity care can take many different forms. Neglect, verbal, emotional, physical abuse, sexual abuse even, lack of confidentiality and consensual care, and inappropriate use of medical intervention. So it's a big health issue, but it's also a rights issue. It's about women's autonomy, their dignity, feelings, the choices they're able to make, and their preferences. It's about how we treat women when they can be at their most in need of support and really good quality care. So that's the first thing we know. The second thing we know is it's a widespread problem. I mean, studies are reporting occurrences of mistreatment of women in facility childbirth ranging from between 15 and 98% even. In one study in Ethiopia, 75% of women said they'd experienced disrespect or abuse, and there's similar results from elsewhere in the world. So it's widespread and needs addressing. The third thing we know is that women want us to take action on this, as you say. I really pay tribute to the White Ribbon Alliance's work to bring this issue to global attention. Their work to identify what women want worldwide found that it was a top demand from more than 1 million women in 114 countries. So it's an issue on which action is being demanded of us. And the fourth thing we know, the final one I would want to highlight, is whilst we understand some of the causes of disrespectful maternity care, and we know there's a link with gender inequality, poverty, power inequalities, weak healthcare systems, and a lack of political commitment to address the issue, there's still a lot we don't know. So one of the things I think we need to do is deepen our understanding of what works in this area, what are the most effective interventions, so that we can apply those and scale up and be really effective.
Well, thanks, Darren. And these 4 things that we know happened even before, COVID-19. And now that we have COVID-19 and we have to respond to this pandemic, why is it critical for person-centered maternity care to be emphasized, especially, as part of provider training, and even as we all are looking at, the proper ways to respond to the needs of women and adolescents during this pandemic?
Well, it's always important to address this issue. So, it's part about driving up standards of healthcare generally. And we know that patient safety is a huge issue. More people are dying because of poor quality care than because they can't have access to care. So this has always been an important issue for us. But you're absolutely right that at this point in time, the risks are even higher. The ongoing pandemic is impacting maternity care services, and particularly in countries where those health services are already overstretched. And as systems come under pressure, the problems can get even worse. So we're hearing reports of numerous violations of the rights to maternity, quality maternity care during the COVID pandemic. Some women are finding they're being banned from having birth companions with them, even though lockdown restrictions are being lifted. We're hearing about women who are separated forcibly from their newborn children and they're prevented from breastfeeding. And we're hearing of cases of where medical interventions are made without consent in order to speed up the process and get people through the system faster. And of course, the risk is if women don't believe they're going to get good quality care, then they'll be even less likely to access the facilities. And that, of course, increases the risks to them even further. So as we do step up the work we're doing to support training for the pandemic response, we should absolutely be emphasising the need for respectful maternity care as part of that. We mustn't allow respectful, high quality care to become another victim of the COVID pandemic.
Well, thank you. And you know, these violations are, we are seeing them across the globe. It's not in just one particular country. We have women complain from one country to the other, all the way from Africa to Asia to the US to the UK. But I would like to get, you know, your commitment and just ask you, you know, in your capacity as Director of Policy and Foreign, Commonwealth and Development Office, what will you do going forward, and what are you doing to address issues around disrespect and ensure respectful maternity care for women?
That's a great question. So you're absolutely right. You know, words are good, but what are we going to do to address this problem? Well, as the Director of Policy at the Foreign, Commonwealth and Development Office, I lead our work on global health, but also much of our work on gender and on gender equality and on reducing violence against women and girls. So this is an issue we're going to tackle from a number of different angles. And the UK government of mothers, newborns and children. So this is going to be a key to that endeavour. I think I list three things we're going to do practically. So first of all, we're prioritising strengthening national health systems to focus on quality provision of essential services. And that's going to include respectful maternity care. The second thing we're going to do is we're developing new guidance to build our own staff's understanding and their skills to support respectful maternity care at the national and global levels. And third, we're going to work even more closely with partners on this issue, including through the Partnership on Maternal and Newborn and Child Health, because it's only by pulling together that we're really going to make the difference we all want to see.
Thank you very much. I really like partnerships and pulling together, and you know, all these collaborative acts, which I think are very, very key terms to use, and one of the things that we are going for in this accountability breakfast. So thank you for your support, and yeah, looking forward to just see everyone coming together for the rights of women, children, and adolescents. So thank you, Darren. I think I'll end it.
Absolutely agree. Thank you so much.
Thank you very much.